Welcome to Facial Plastics Friday. It's Dr. Brace here, and today, by request, I'm discussing mini lifts versus a full facelift. So to put it right out there, there's no such thing as a mini lift. That means something different to every person that calls their surgery or their procedure a mini lift. It's like the term sports car. If you go into a car dealership and say, I want to see your sports car, that could be a Lamborghini, that could be a Hyundai. It's a totally different thing in each office. Some people would call a mini lift an actual surgical incision around the ear that doesn't go too high or too far behind, and you just tighten what you can tighten up through that incision. To other people, it's profound and liposuction. To other people, it may mean threads for a thread lift. So asking for a mini lift is a very, very vague way to communicate what you want to have done. The other thing I see people say is when they say they want a mini lift, they say, I just want something mini to do this. And they'll like bunch their skin up in front of their ear and their sideburn. And what you're talking about there is a full facelift. And so one of the things I'll often say to my staff is a mini lift is basically a minimal procedure that will give you a minimal result. And that holds true in most cases. And so if you have a jowl, skin hanging here, if you have deep nasolabial folds, if you have loose skin under your chin, loose skin in your neck, a mini lift, whatever that may be, is not what you're asking for. You're asking for a facelift. And the reason why people call things like a mini lift or use other terms like a minimal access lift or a weekend lift or an S lift or any other branded name is because there's a stigma to facelift. And surgeons try to get people away from the stigma by calling their surgery something else. And so what you need to know is there's different types of facelifts. Some of them are shorter scars than others, and not every person is a candidate for each type of facelift. If you have a lot of hanging skin, you need a longer incision to get rid of that skin, or you'll end up with a fold of skin called a dog ear, either up here or in behind your ear. So the length of the incision has to be appropriate to the amount of skin that's trying to be removed. There are different layers in the face. We have our skin that we can see. Underneath that, there's a little bit of fat, but then there's a layer called the SMAS, the superficial musculo-aponeurotic system, and that's what attaches your facial muscles to your skin so that when you smile, things will move. A deep plane facelift will go underneath your SMAS and will release the ligaments that attach your SMAS to your facial skeleton and let the whole thing be redraped. And it's the most powerful facelift technique, in my opinion, to get the most natural result with the most movement of tissue. There are other more minor procedures you can perform on the SMAS, like just bunching it up with stitches, and that's called a SMAS plication. Or you can cut a strip out of it, and that's called a SMAS imbrication, and sew it up and tighten it. But if you haven't released the ligaments that are holding it to your cheek, you're gonna have minimal amount of movement, and you'll never improve the nasolabial folds as much as you will with a deep plane facelift. So here in my practice, when I talk to people about a facelift, I never say mini lift or weekend lift. What I talk to them about is either a minimal access deep plane lift, which is a short scar, or a standard deep plane facelift. A facelift lift, a standard facelift will lift your cheeks, will lift your jawline, will lift your neck. A minimal access deep plane facelift is for the person that really doesn't have a lot of hanging skin, and you don't have to take a lot out, and they can get their cheeks up and their jawline tighter and their neck a little bit tighter, but they don't have lots of skin to remove. So I hope that clears it up. If you have any facelift questions, mini lift questions, or any other facial rejuvenation technique questions, send them our way. Have a great weekend.